Okay, more sniff ideas. Okay, so here's another few more tips that I would like to suggest to you guys on how to be able to make getting referrals easier and also increase the chances that you keep on getting called for these referrals. So one thing that I suggest, and here's one of my tips, is you want to be able to send that staff member, either the liaison or your marketer or your supervisor or even yourself if you're the administrator or the director of nursing, or if you are the marketer as well, right? So what you want to be able to do is when there is a referral, you should pretty much drop almost everything that you need to do and go straight to that facility. You need to make sure that within 3 to 4 hours, and not more than that, one person or a representative from your company needs to be at the doors of that sniff unit, of that rehab unit, in order to be able to receive all the information necessary for you to admit a patient. And once again, I'll start from the beginning. Make sure that there is a referral made to your agency already. There's already an order to refer the patient to you. What you want to do is once you get there, by you showing that you are responsive, that you respond quickly, it's going to be able to show to that facility that you're very interested and your goal is to take care of the patients. You also want to allow yourself to take a variety of different patients. When you go into these SNF facilities, you're hoping to get a lot of Medicare patients because ultimately those are the breadwinners of the home health agency. But you're going to have to open yourself up to be able to accept other patients as well. For example, you have your Medicaid patients, and also at the same time as you're going to have other insurances that are covering some of the patients that are being discharged. We're starting to see a large amount of managed care grow all over the United States. Managed care is already seen a lot in the East Coast and in the West Coast. And lately it's increasing more and more in the Midwest, in the central states of the United States. So you want to be able to be the person that will accept every single patient. Even in the beginning, you are going to be tried. Some of these facilities are going to try to give you a hard patient. But imagine this, if you can show them that you took great care of a hard case, imagine you can go back into them and tell them, look, you guys gave us a hard case, we took great care. Imagine what we can do with the average type of patients, with the other types of patients that you will start referring to us. You want to be able to answer the call of the discharge planners. You want them, where they call you, they know you will handle everything for them once they have a referral for home health. That's what you need to do. So make sure you take a variety of the patients. Yes, you will be taking some wound patients, which can be costly for the agency. But what your goal here is to be the number one person to be called, the first in their mind. The last thing that these discharge planners and social workers are worrying about is they don't want to be calling 5, 10, 15, 20 home health agencies before they can actually get someone to say yes to a particular patient. If they start understanding that if they call you, you're going to take care of it, then they're going to start relying on you more. Also, when you walk into a facility, when you're marketing your company, one of the first pages of your marketing packet, if not the first page of your marketing packet, should say which kind of insurances or payments do you accept. Remember, the more that you accept, the more that you're going to be the number one person called to these facilities. I've met so many home health agencies that don't take an advantage of being able to find multiple sources of incomes. Remember, as a company, just like large companies out there, they don't just rely on one source of income. They rely on multiple sources. They invest and purchase other companies so that they have other money or other sources coming into the organization. it should be the same exact way for your company. You should make sure that you are able to allow your agency to accept multiple payer sources in order to differentiate yourself, in order to better yourself, in order to stand out from those other agencies who are only approved by Medicare. So many agencies out there are not even approved by Medicaid or even seek to get approved by Medicaid. And the reason why they do that is because they say, well, why should I if I'm not going to be accepting Medicaid patients? Well, guess what? You should do something about it, because that's the only way you're going to differentiate yourself. You're not always going to get Medicaid patients, but if you do accept them, and also, when you are accepting Medicaid patients, the reason why your agency is not making profit from it, it's because you unfortunately mismanage your salary caps. You're paying too much to your nurses, to your clinicians, and because of that, the return on your investment is not there. You're not making money. It still should be some profits, very minimum for Medicaid patients or maybe some managed care patients. But the reason why your income, the reason why you're not able to have a profit is for the reason that you are overpaying your staff. Yes, I'm a nurse, and I'm sure most of the people that are in this industry as owners, as administrators, are nurses as well. And we want to get paid more than what we deserve. But the thing though is, if you are running a business and you are not able to get enough patients, yet you are paying your nurses high amount, that could cause some problems. Pretty much this is a whole other aspect of management, and we have a separate division that's going to be able to work with your organization to teach you ultimately how to be able to properly manage the clinical part, the HR part of your company. Right now, let's go ahead and just worry about how to be able to get more referral sources, more companies to start giving you. So like I said, make sure you take a variety of patients. Don't just say you want Medicare patients, accept others as well. The next thing we want to be able to talk about is what I call a patient card. A patient card. What a patient card for us is this, is that I've actually used our ID badge maker. And whenever time we admit a patient, we actually put all the detailed information in this card. Pretty much the one side will have all the information of our home health agency and also the patient's name and their address, and as well as some basic information like their date of birth. And if the patient allows us, we will put their Medicare number there as well. In the other side of the card, we put all their diagnosis and as well as their current medications and dosages that they are taking, and there's going to be a note there stating that these are the medications as of this day. What we also add to that is patient history in regards to, for example, what was the last hospital that this patient stayed at? What was the last nursing home they were staying at? And also, once again, our home health agency contact information. What this is doing, oh, don't forget, we also put the allergies as well of the patient. So let's go explain to you why we do this. If you show to a skilled nursing facility, if you show to a hospital, or if you show the physician that you are doing this, what it does is it's doing what we call a reverse referral. We explain to the skilled nursing facility that if the patient gets discharged from our home health agency and one of these days they end up in the hospital, we always instruct the patient to hand over this card to the admission person because it has all their vital information that is truly needed. And at the same time as it shows the name of their skilled nursing facility, so that hopefully if the patient gets discharged and the patient actually needs to be admitted into a skilled nursing facility, they would know to recommend this patient to go to that skilled nursing facility. It's all about continuation of care and trying to make sure that the patient is cared for by the same people who already has cared for them in the past. By you doing this, by you making a initiation of helping the skilled nursing facility to make sure they can get these patients back to their agency, you're helping them they will also want to recommend you and help you as well. The next thing is this. If a patient needs any DMEs or any medications ordered, or if the patient needs to start an IV at home therapy, what you are there for when you go and pick up the information from the patient, you can initiate the transfer of the information and start ordering the necessary items for the patient. The last thing you want is a patient needing a bedside commode, or the patient needing a wheelchair, or the patient needing some walkers or oxygen, and you have to order those items pretty much the next day or the same day that the patient arrives. What's going to end up happening is you won't possibly get that till the following day, or if you reach the weekend, it might be even a little bit harder. So your job is to make sure that before the patient is discharged to home, you are able to order all medical equipment ahead of time, which will make things faster and the care for the patients better. What would happen if a patient goes home and there's no oxygen with the patient that they needed? What are your protocols from that? And make sure your company has protocols for these such events. But ultimately, it's a matter of getting the transition information, the transition of care started as soon as possible to care for these clients and to be able to take great care of them.